Hi, Dr. Steen here. I am a surgical oncologist in California. I have many patients diagnosed with breast cancer who are overwhelmed with the decision between lumpectomy or mastectomy. This video is to help you form a larger overview between the two surgeries to help make a decision about which one may be best for you. First of all, it is important to understand the basic terminology. A lumpectomy is the term for a surgery that removes a portion of the breast containing the tumor with a rim of normal breast tissue around it. This is done through a cut in the skin which is sewn shut afterwards. Lumpectomy is always combined with radiation after surgery. A mastectomy is removal of all of the breast tissue. The majority of mastectomies remove the nipple and the skin around the nipple with an ellipse of the skin. Let's talk about survival. The first point is that for the properly selected patient, a lumpectomy with radiation and a mastectomy are considered equivalent in regards to how long somebody will survive from their breast cancer. Lumpectomy has a risk of the tumor regrowing in the same breast because you left some remaining breast behind. If you had a lumpectomy for breast cancer and radiation to the breast after surgery, the risk of cancer regrowing in the same breast is around 10%. A mastectomy usually does not need radiation after surgery, and the local recurrence rate after a mastectomy is less than 1% since there is no breast tissue left behind. After a lumpectomy with radiation, we watch closely with mammograms, and if something does regrow, we catch it early, and at that point you would need a mastectomy. Because these recurrences are caught early and treated before they become dangerous, the survival is the same as if the entire breast was removed initially. And it only becomes an issue of having a regrowth in about 10% of patients, so the other 90% will never have another cancer in the breast. This is why lumpectomy is probably the most common approach to a small breast cancer. Here are some other differences between the two approaches. Let's talk about surgery. On the lumpectomy side, the pros are that it's a day surgery. You can go home after the surgery. Mastectomy typically requires one night in the hospital. Lumpectomy is a small cut, so it has a lower risk of wound problems such as skin infections or bleeding. Mastectomy has a much longer incision and it removes a lot more tissue, so there is a higher risk of bleeding or wound infections or problems with healing of the skin. If you need chemotherapy after surgery, problems with wound healing can delay chemotherapy, which could be bad for your cancer treatment. Lumpectomy preserves the sensation of the breast, the skin, and the nipple. After a mastectomy, though, the remaining breast skin is numb, and that is permanent. This can be an issue for some women. Lumpectomy surgery is usually the only surgery you need for the breast cancer. As long as the edges of the tissue are clear from tumor, lumpectomy surgery is usually a good cosmetic outcome without any additional plastic surgery. The breast will look almost exactly the same after surgery, and even after radiation, except for seeing a scar and maybe a little skin darkening from the radiation. But certainly with clothes on, most lumpectomy surgeries are not noticeable. Another common misconception is that mastectomy can be done with an immediate breast reconstruction, and somebody will come out of the first surgery with an essentially normal-looking breast. But this is not the case. Even if somebody chooses to undergo a reconstruction at the same time of the mastectomy, it is usually the first step of several more surgeries. If there is an implant involved in the reconstruction, the first thing placed in the breast is an expander. This expander is expanded with water. Then when it has stretched out the space after several weeks, the final implant is put in. Frequently, scars need revision and nipples need reconstruction and tattoos. The point is that even a breast reconstruction done immediately still takes several more surgeries over the next 3 to 6 months in order to be finished. The other way to do a reconstruction after a mastectomy is to do a delayed reconstruction, which can occur many months or years later. Next, let's talk about radiation. Lumpectomy removes only a portion of the breast tissue, and we know that the remaining breast on that side tends to regrow cancerous cells if radiation is not given. Even if the edges of the lumpectomy are clear of cancerous cells, there is still the possibility of cancerous cells stuck elsewhere in the breast. Perhaps they were traveling through blood vessels or lymphatic channels. Radiation works very well to kill these individual cells no matter where they are in the breast. Radiation does not work well on the main clump of cancer cells, since this represents millions of cells. I like to explain it like this. Surgery removes 99.9% of the cancerous cells from the breast, and radiation cleans up the remaining 0.1% of the cells. For most of these cases, mastectomy removes all of the breast tissue, so radiation would not be needed. But there are situations where you would still need radiation even after a mastectomy. If your doctor tells you that a mastectomy is needed because the breast cancer is large, say over 5 centimeters, or if there are multiple lymph nodes in the armpit that have cancer in them, or the cancer is growing into the skin or the chest muscles, then radiation may still be used, even after a mastectomy surgery. Well, what if you just can't have a lumpectomy? Some women can't safely be offered a lumpectomy even if they want one. Examples of situations where we cannot safely offer a lumpectomy are as follows. If you've had previous radiation to your breast area, since we always need radiation after a lumpectomy and you cannot radiate the same part of the body twice in your life, so if you've already had radiation to the breast, we really can't offer a lumpectomy. People that cannot have radiation due to other medical problems, such as scleroderma, which is a skin disease, radiation can cause too many problems in these people. What if you have cancer in multiple different parts of the breast? Doing 2 lumpectomies on opposite sides of the breast is not commonly done. If we know or suspect that cancer is in different locations in multiple quadrants of a breast, we usually recommend mastectomy. And lastly, we don't offer lumpectomy surgery if a cancer is over 5 centimeters in size, which is about the size of a tangerine. Let's talk a little bit about chemotherapy. A very common misconception is that women think if they choose a mastectomy that they won't need chemotherapy. This is not the case. I like to explain it like this. You just cannot out-operate the need for chemotherapy. Surgery and radiation treat the breast and the lymph nodes, but do not do anything outside of that area. And breast cancer is really only dangerous when the cells grow outside of the breast and they have metastasized to organs such as the liver or the brain or the lungs. Even at the time of your diagnosis, if X-ray scans show no spread of cancer outside of the breast, there is a chance that some microscopic cancer cells are floating around your body in the blood. Chemotherapy is the only treatment that gets these cells, no matter where they are in your body, because chemotherapy goes into your blood and gets everywhere in the body. So if we think you need chemotherapy to get these cells floating around your body, any treatment we do to the breast with surgery or radiation does not change that decision. So this is a brief overview of some of the differences between lumpectomy and mastectomy surgery that can affect the choices you make. I do explain the individual surgeries a little bit more detailed in some of my other videos on the channel, so don't forget to subscribe and check those out. I hope this helped. Take care.